speech on a pervasive speech that is hopefully going to steer you towards understanding that physical education in our school system is vitally important. Nearly 10 million children and adolescents between the ages of 6 and 19 are currently classified as obese by the CDC. Based on my research, I discovered very discouraging facts about childhood obesity and the direct correlation of the disappearance of physical education from not only our homes, but from our school system. The facts about childhood obesity will be presented. The benefits of keeping physical education programs in our schools will be presented, and some fun things that we can do as families to help our children not become physically obese. The following statistics come from the American Heart Association's fact sheet done last year in March. Nearly 10 million children and adolescents between the ages of 6 and 19 are classified as obese. Along with the rising obesity rates, prescription drug use by children in that same age group is rising for high blood pressure, for diabetes, and also heart medicine. Some experts claim that by the year 2015, 71% of our population will be considered overweight, 45% of the population will be considered extremely obese. And in an era when obesity is challenging our national security and our competitive advantage in the world market, we're getting rid of physical education programs in schools that could help curb the efforts of our children becoming obese. The benefits, these are recommended by the CDC, the Surgeon General's report. Obviously, exercise helps to build healthy muscles and bones. It helps to build strong muscles that'll help you control your weight, build lean muscle. It'll reduce fat by thereby preventing the need for all the medical care that goes associated with being obese. Also, evidence suggests that normal weight children are not only less absent from school, they academically achieve higher standards than their obese counterparts. The American Heart Association also has a fact sheet out about things that we can do as a family and as a community to keep school, provide quality, preferably daily physical education in a K-12 setting by hiring actual phys ed teachers, not just having a teacher go out and have them run around and play on the swing set. Create opportunities for physical activities that are solely based around certain genders, senior citizens, children, ethnic groups. Make programs available so that way that each one of those areas is covered. So that way, if your child likes to play basketball, they have the chance to play basketball after school. All these programs need to remain, because if we don't, we're going to end up with a very chubby society, and that's a very dangerous thing. The other thing that the CDC recommends is that we encourage our healthcare providers to get ahead of their patients and encourage them to participate in physical activities and to get mom and dad involved with their children, because a lot of times when we have our children, when we tell our children to do something, it's do as I say, not as I do, whereas we need to become a part of it. The hope of this speech was that you would understand that we need to be aware of the facts of childhood obesity, and that we also need to ensure that we're reaching out to the lower income groups, and that we're also fighting for physical education programs within our school system to prevent a future children that turn out to be obese adults. We need to, who lack the instruction and the knowledge to maintain a physical, proper physical body, physical education. We must obviously teach them as children, because if we don't, we're going to be facing a country that's rising medical costs, and our advantage over other nations is severely compromised because we can't keep up. I thank you for your time, and God bless.